Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth When Sees Menopause in the Heart, Hidden Dangers After Transition. And trust me, it's juicier than your cousin's peach cobbler. Ladies, let me hit you with a number that'll make you spit out your morning coffee. Did you know your heart attack risk can triple within 10 years after menopause? Yep, entirely true. I can't make this stuff up. Today, we're diving deep into why this happens and what you absolutely need to do about it. Now, before menopause, you've got this incredible built-in bodyguard protecting your heart, and her name is estrogen. Think of estrogen as your personal cardiovascular bouncer. She's keeping all the troublemakers out of the club. She keeps your blood vessels flexible like a good garden hose, prevents plaque from setting up camp in your arteries, and basically tells your cardiovascular system, "Not today, Satan." But here's where things get interesting, and by interesting I mean terrifying. When menopause hits, estrogen doesn't just clock out for the day, she packs her bags and moves to Florida permanently. Your cardiovascular system suddenly goes from having premium security to being completely unprotected. It's like going from a gated community to leaving your front door wide open with a sign that says, "Free stuff inside." Now, the really sneaky part about all this is how these changes creep up on you. We're talking about the cardiovascular equivalent of that friend who slowly borrows all your clothes until your closet's empty. Your blood pressure starts climbing like it's training for Mount Everest, but you don't feel it. Your cholesterol decides to throw a party where the bad cholesterol multiplies like rabbits while the good cholesterol gets voted off the island. And don't even get me started on how your body suddenly thinks your belly is the perfect storage unit for extra fat, which puts even more stress on your heart. These changes are masters of disguise. They happen so gradually that you don't notice until boom. You're at your annual checkup and your doctor's looking at your numbers like they're reading a Stephen King novel. Let me tell you about Sarah. And if you're out there listening, Sarah, you know I'm talking about you. This woman was a 52-year-old marathon runner who could probably outrun me backwards in high heels. She came to see me because her primary care doctor noticed her cholesterol had jumped 40 points after menopause. 40 points? That's like going from a gentle spring rain to a Category 3 hurricane. Now Sarah thought she was bulletproof because she was in incredible shape, but when we dug deeper, we found early arterial stiffness developing. Her arteries were starting to act like old rubber bands instead of flexible tubing. This brilliant, healthy woman was developing heart disease, despite doing everything right, simply because her hormonal protection had vanished. This is why I tell my patients, and maybe I should see you in the clinic, we need to talk, that even if you're the picture of health, menopause changes the game completely. Here's what really gets my attention as a cardiologist. The first 10 years after menopause are when your risk doesn't just increase, it accelerates like a Tesla in ludicrous mode. This is your critical window, ladies. Think of it as your heart health reset opportunity. Except instead of getting 3 wishes from a genie, you get 1 chance to prevent decades of potential problems. This is when regular cardiovascular screenings shift from probably a good idea to absolutely essential. We're not talking about just checking your pulse and calling it a day. We need to get serious about early intervention because catching these changes early can prevent long-term heart damage that could literally save your life. So here's what you're going to do, and I want you to write this down or put it in your phone right now. Within 1 year of your last period, you need to schedule a comprehensive heart screening. Not just the basic stuff your primary care doctor runs. I'm talking about the full workup. Ask specifically about calcium scoring, which shows us if there's any plaque building up in your arteries, and advanced lipid panels that give us the real story about what your cholesterol is doing. Your heart's future depends on taking action today, not next month, not when you get around to it, but today. Because unlike that protection you used to get from estrogen, the protection you can build through proper screening and early intervention is something you can actually control. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.